Good afternoon and welcome everyone. Welcome to our June 4th Thursday Lunch and Learn. Please remember to hold your questions until the end. I will soon be muting the phones, but we'll unmute them for questions and we will also accept questions by chat. I would now like to introduce Jenny Thompson Kirkland, formerly with the NCI Cancer Information Service and now with the Houston affiliate of Susan G. Komen for the Cure, and Linda Civallero, from MD Anderson Cancer Center, Center for Community Engaged Translational Research. Together they will present information about evidence-based programs.
All callers are muted and they can unmute themselves.
Hi, this is Linda Civallero, and I'm here with Jenny, and we just wanted to tell you who else is in the room. We'll go around the room here.
Lynn Widlowski, Executive Director for the Breast Health Collaborative of Texas.
Jessica Felice, grants intern for Susan G. Komen.
Judith Miller with Judith Miller Counseling Services and Cooperative Parenting Solutions.
Okay, Lisa Mason, Federal Cancer Association.
Mohammed Hussein with Medicare Cancer Centers.
And Ashley Francis with the Breast Health Collaborative of Texas. Okay, so I'm going to unmute the phone so everyone can introduce themselves. Hold on a moment.
All callers are muted.
So who's on the line? Can you please introduce yourself?
We've never done it without it.
All callers are unmuted.
Okay, can we get some introductions? Who's on the phone?
Hi, I'm Jan Barnett with Cancer Care Services.
Should we go in order of the list on the webinar?
Oh, that's a good idea. Thank you. So, we'll start with Betty. Okay. Donna.
That's okay. It sounds like we're not used to doing this, but we can see, I'm Linda Civallero from MD Anderson, and we can see the list of all of the participants, and I believe you can also on the left side of your screen, or if you open up the participants tab. Jenny and I are
All callers are muted and they can unmute themselves.
Jenny and I are very excited to be here to talk to you about using evidence-based programs. First, I'd like to tell you a little bit about where this information is coming from. Jenny and I, Komen Houston and MD Anderson, and also the Breast Health Collaborative, and probably many of you are partners with LINC, the Latinos in a Network for Cancer Control, which is a program at the UT School of Public Health, and Dr. Maria Fernandez is the principal investigator. The program is funded by the Cancer Prevention, it's part of the Cancer Prevention and Control Research Network. And as you can see on the map, there are several sites that are funded across the country, and this funding is from the CDC and the National Cancer Institute. And their focus is to disseminate and translate proven interventions into practice to reduce the cancer burden, specifically in minority and medically underserved populations. Lynn Widlowski asked Ginny to give this presentation based on your comments on the last Breast Health Summit. And, okay, Lynn asked us to give this presentation based on your requests in the comments from the last Breast Health Summit. Okay. And specifically, the requests were for more training or information on best practices, and also using out-of-the-box programs for cancer control.
We're working on our volume. I'm sorry.
Did that help a little bit more? I'm speaking right into the Polycom.
Yes.
Okay. So just to repeat that, the information that we're presenting is based on requests from participants at the last Breast Health Summit, and there were requests for additional training and information on best practices and also using out-of-the-box programs. So you may be familiar with the steps for planning health programs using evidence, and sorry, our slide may be a little out of whack here. These are steps for using evidence-based programs, and today we're just going to focus on defining evidence and finding evidence, but we'll also talk about what to do when you can't find evidence to support the kind of project that you want to do. So our objectives are to define and discuss evidence-based approaches and to identify where to find and how to use evidence-based approaches, specifically for grant applications, but also this is beneficial for just planning your programs or trying something new when you're trying to increase screening or increase participation in your programs. So I'm going to cover the first part on defining evidence, and Ginny's going to cover the second part on where to find it. Our objectives here are to define evidence-based programs and approaches, and to discuss what the evidence means and also the benefits and challenges associated with using evidence. First, I'd like to open, and I don't know how easily this works, but to ask for input on what you think is evidence. What kind of evidence have you used, or in what settings have you heard these terms?
All callers are muted. All callers are unmuted.
Okay.
How was Lauren and what
So-
she was doing, and so
So we can,
she said that
everybody,
she said Lauren is sad, but she's okay.
everybody's been unmuted so we can hear any personal or other conversations. So you can either answer the question, what do you think of when you hear the term evidence-based, by typing it in, or you can just speak into the phone. And we'll just take a couple of comments. When have you heard evidence?
Someone typing, I hope two people.
Okay.
Multiple attendees are typing.
Present some information based on the study outcome, the scientific data.
Yes, so we had one comment in the room that it's based on study outcomes and scientific data, and that's correct.
And then test it over time, used again and again, and document it.
Yes.
It is based on the outcomes of previous testing.
All great. Okay, I think those are all great comments, and we'll stop there, and we can.
All callers are muted and they can unmute themselves.
We all have great comments. The push for more effective use of evidence-based programs and strategies began with evidence-based medicine, and now we hear about evidence-based practice all the time in many different contexts, including in public health and the work that we do every day. For this purpose, we'll define evidence that guides public health practice as the available body of facts or information indicating whether a belief is true or valid. So, like many of you said, it's something that has been tested and proven to work. And somebody mentioned that we're still having voice quality issues. I don't know if it's the line or if it's me specifically, but I'll try to talk right into the mic. Okay, so there are many sources of valuable evidence, ranging from more subjective, practice-based evidence that includes things like personal experience of something that happened in your own practice, in your clinic, in your community-based organization, or word of mouth, something that you heard another group did that worked, or program evaluation, that you conducted a more rigorous evaluation of your own program. And this is usually done in a smaller setting, in a smaller population, and in conditions that are variable. They might vary from You know, if you're recruiting participants to a program, you may not do it exactly the same way from one time to the next time. And then the range of evidence goes to a more research-based evidence that's derived under highly controlled conditions. And this may not and really doesn't exist in reality, but testing these programs and strategies under highly controlled conditions is essential for measuring whether you have a true cause and effect. Did doing this one specific thing for your program, was that the reason that you had a higher rate of return for mammography, or whatever it is you're trying to improve? So the stronger research-based evidence includes an intervention study that a researcher might conduct, and a systematic review of multiple similar studies that talk about certain strategies, and also surveillance data. So next, we'll talk about what are some evidence-based approaches, and we categorize them into 3 different groups: programs that are defined sets of activities that have been rigorously evaluated or tested in a research project, strategies that are really broad-based recommendations, and they're based on systematic reviews of multiple studies. And strategies are usually just one component of a program. So a program can have many strategies, or it can be based on one primary or key strategy, and we'll look at a couple of examples of both of those. And then there are policies or laws or regulations that have been evaluated and research tested and found to be effective, like the policy to increase the cost of a pack of cigarettes. And there are lots of results that show that increasing the cost of a package of cigarettes significantly reduces smoking rate. Okay, so we'll look at, I've circled policy and strategy together because the resources that we have available, at least readily available through the internet, tend to have policies and strategies in the same resource, and programs in another resource. So first, about programs, you may have heard of these or be familiar with them. Cultivando la Salud and the Witness Project are both examples of large-scale programs that are funded by the government or other large private funders. And these projects specifically are funded by the National Cancer Institute or the Centers for Disease Control. And when they were developed, they were carefully controlled in terms of who was recruited to participate, how the programs were implemented, how they were evaluated and analyzed. And this was to be sure that it was the program and not some other factor that accounted for the observed effects, such as an increase in mammography screening. And one of the resources that Ginny's going to talk about is RTIPS, Research Tested Intervention Programs. And that is a resource for finding packaged programs. I'm going to show you the kinds of information that you can find in RTIPS on the Witness Project. These are programs that are well documented, and then they're packaged. So the researcher develops them, finds that they work, and then they package the materials to try them again in another population, or to make them available to practitioners like us who may want to use them in a similar population. And the kinds of information available in RTIPS includes the aim, what was the purpose of the project, and this one was to increase breast and cervical screening. What was the setting, and here it was churches and community organizations. The target audience, African American women. And then there's information about the program components that are available. And for this specific project, there's information about witness role models and their role in disseminating the intervention. That includes their personal stories, and the role models are survivors for this project. And there's a spiritual context. And the materials have been packaged so that they're available, and many of the programs on RTIPS are available for free. And for this program, they're available on a CD-ROM, so you're able to print the brochure or look at the video, print the training materials for the lay health workers or the role models. And this project has been implemented in over 25 sites with hundreds of volunteers that are delivering cancer education and screening programs. And the neat thing about the Witness Project is that it was developed over 10 years ago, I believe in 1999, and it is still being implemented. So people have learned from these materials and from each other. So it's now a best practice that this has worked in many settings, and it continues to be implemented. And the other project on the slide before was Cultivando la Salud. And this is a project that's not in our tips, but it was tested in a farm worker population. It was found to work, and now Dr. Fernandez and other researchers are testing it in other populations. Currently, they have funding from CPRIT, the Cancer Prevention and Research Institute of Texas, and it's being implemented here in Houston, and it's being tested with Hispanic, Spanish-speaking women to increase breast and cervical cancer screening. So the idea here is if you're using programs that have been shown to work, you're likely, you can prove that they've worked before because there's a lot of evidence available from the projects themselves and the papers they've published and our tips that you can use that kind of information in your grant applications to say, this has been shown to work and we're going to use it in our population. So those are packaged programs that are available. I guess the one downfall is there isn't a packaged program available for everything that you want to do. So when you can't find a whole program or when you don't have the resources to implement a whole program, then you want to look at what are some specific strategies or activities that have been put into practice before, they've been evaluated or rigorously tested, and they've been found to work. So for our purpose, a strategy is something that is recommended, and it's usually part of a larger program, but strategies have been looked at over many different, they've been tested over many different settings or many different research projects, and this specific strategy has been shown to work in many different programs. And often this is something that we go to look at what strategy you want to implement or add to your program. And one specific example of a strategy, and this comes from the community guide, and Ginny will talk about how you go to the community guide and what kinds of things you'll find there. But an example of a strategy to increase breast cancer screening, and really breast, cervical, and colorectal cancer screening, is client-oriented interventions. So the aim is to increase screening, and the community guide shows us that there are several things, several strategies that are recommended to increase screening, and one of them is client reminders. And there's additional information about what are client reminders and how you can use them. And Ginny will talk about that in the next part. So strategies can be very low tech, and they've been shown to be effective. So it's helpful to use them. So more specifically, some advantages to using evidence-based approaches. We always want to meet the challenge of proving that prevention is a worthwhile investment and that the programs we select are having a positive impact. And especially with today's funding climate, proposing to use evidence in your grants and even in new projects helps to show or add value to your grant application. And specifically, it responds to some RFAs like CPRIT, the Cancer Prevention and Research Institute of Texas, Komen, Houston, and the LINK, Latinos in a Network for Cancer Control mini grants, where they ask you to use evidence-based programs or strategies because they want us to ensure that the projects that we're doing could be effective. So evidence-based approaches can save you time and money when you're planning because you may have some of the materials already available where you don't have to recreate the wheel or start from scratch. You could adapt the materials, but you have a good starting point. They also help you to focus your evaluation just on a specific part of the program or a strategy instead of evaluating everything that may not have an impact on the outcome that you want. And also, it'll increase your likelihood of success since they've been shown to work. And also on the flip side, we want to talk about some of the challenges to using evidence-based approaches. And one of them is when you already know what program you want to implement and you don't really find a match, or you want it to be a little more innovative. One of the things that could address this comment or challenge is that perhaps in the program that you're thinking about implementing, there's a strategy or several strategies that are already in the community guide, and you can say in my program we will be using X strategy that is has been tested, and you can talk about what the community guide says about it. Another challenge is that you don't know how to describe using this evidence-based approach in a grant application. And Ginny will show you the kinds of information that's available in the community guide and our tips, and they have some real specific citations for how these programs were written up into published literature, or what the systematic review says about a specific strategy. Another challenge, I've not used them before, so we'll look at, briefly how to look at some of these resources. And really, you just need to spend some time on the website or with literature reading about these materials to get comfortable and more familiar with them. And also, if you don't have a whole lot of funding to implement a whole program like the ones in our tips, and usually we don't, and that's when it's a good idea to think about a specific strategy instead of a whole package program. What depends on what kind of funding you have and what amount of time you have to implement a program. So I think if you have any questions here, you can ask by typing them in. That seems to work a little bit better. So we'll take a second just to see if you have any thoughts on any of those. Okay, so I'll turn over the floor to Ginny.
Thanks, Linda. You gave us a great overview of the definitions and examples. So I'm going to get into kind of where we can find some of these resources. So hopefully you know what the audience is you're trying to reach, and the disease and behavior. And most of the examples we're going to be using today are about breast cancer screening, but I can talk a little bit about maybe where some other evidence is for other behaviors, and really what we're doing would cross over to other behaviors. You're just going to switch out the behavior. And so now we want to search for products that may fit with what you're trying to do, or if there's not a lot of evidence around what you want to do, some additional resources where you can find some more information. So let's get started. So mainly we're going to focus on the Cancer Control Planet. How many of y'all have heard of the Cancer Control Planet? Lynn raised her hand, thank you, and I have some other people that haven't heard of it, and so you can see the website is right there.
Oh, one person raised their hand.
Okay, thank you. Oh, Jenny, of course, Jenny.
And if you want to know how to raise your hand, there's that little guy.
So do you see the little guy where my arrow is? That's how you can raise your hand. So thank you for making this interactive. Okay, Jenna, thank you. So Cancer Control Planet is a web portal, so it contains a lot of links to different websites, and it talks about data. So it has information from the Texas Cancer Registry, so it has all the incidence, mortality for all different types of cancer types. It also talks about information from the Behavioral Risk Factor Surveillance System,
which tells us, gives us the baseline of who's getting a mammogram and who isn't. So all of that information is contained in one area, which makes it really easy to use. There's also some mapping things that you can do under Cancer Control Planet, so that's all under data. And then another section of Cancer Control Planet is called Collaboration. And so, like Linda talked about, Witness Project or Cultivar la Salud, sorry for my botched Spanish. But you can talk to the researcher that created that through this interactive area. So that's under collaboration, and right now they're talking about Dr. Prokhorov at MD Anderson and tobacco and teens and things like that. So they are really trying to make this an interactive way to get information and make it easier for you to implement and use the programs that we've all paid money for. The taxpayers have paid money to see what works, and so we want to make sure everybody has this information so they can be using it. So the third area is research kind of synthesis of what Linda was talking about, looking at systematic reviews to see what has been shown to work. So that's the next area, and that's where the community guide is. That's where the U.S. Preventive Services Task Force information is, which is a clinical guide. And then additional research reviews are also under there. They also have the program area, which is where RTIPS is. RTIPS has the research tested intervention programs. So Witness Project is there, and there's 21 other breast cancer programs that have been shown to increase breast cancer screening are there, so you can look to see how they did their programs, what kind of resources they needed to do those programs, and then there's some ways that you can adapt those programs. They'll walk you through those steps as well. Then there's evaluation information, and then the last one are the plans, the cancer control plans of each state are also listed, and that's where we look at a statewide level, a state level of cancer needs and cancer gaps, and have a report for our state. So we have the Texas Cancer Plan listed there. So you might want to bookmark these two, so you can go back and in my former life, I would give trainings on these websites, and you can spend hours on it because you can get a lot of good information. So keep that in mind. Yeah, Melanie raised her hand. Can everybody hear me? I'm soft-spoken, but I'm hopefully can hear everybody. Thank you. And also, if you have been on RTIPS before, it's celebrating its 10th anniversary, so as you can imagine, it's changed a lot, and I think there's a lot more information on there, easier to get to, so please go review it if you've been to it before. So as Linda mentioned, a strategy is broadly defined based on recommendations of having been shown to be effective in multiple studies. So it's less prescriptive than a program. So there's not a lot of how-to information about the strategy, but at least you know that that's one place to start. So the strategies are in the community guide, which we will go to in a minute. If there's less information that's maybe not found in the community guide, there's something called the Cochrane Collaboration, and it's an international group, and they do systematic reviews. You can also look there. I've gone to that and gotten some good reviews. Under Planet, there's information about how to get a password for using the Cochrane Collaboration. So go back to Planet to get more information about that. And then lastly, the U.S. Preventative Service Task Force is a clinical recommendation guide. And so that's where you hear in the news when the prostate cancer screening guidelines changed, or breast cancer screening guidelines, they start looking at them, or cervical cancer. So that's where all of that's found. So it's good to check to see if your clinic is following those guidelines and things like that. But mostly, we're going to be talking about the Guide to Community Preventive Services. And you can find that link on Planet. So this is the front cover of, we call it the Community Guide for short. So you can see the different topics that it covers. So you can see adolescent health, alcohol, asthma, birth defects, cancer. So a lot of public health providers and public health workers use this to make sure they're using evidence-based strategies. So you would go to get to breast cancer screening, you would go to where it says cancer. So when you pull up the cancer area, you can see that for the community guide, they have systematic reviews broken down by client-oriented interventions, and then also provider-oriented interventions. So we're going to look at the client-oriented interventions for this example. So this is what comes up when you look at the client interventions, and you can see breast cancers circled. That column is going to show you what is recommended and what has insufficient evidence right now. So they do update these reviews every few years, and so you can see the example I'm going to look at are the client reminders. So this was last updated July 2010, but you can also see client incentives. So you can see that client incentives right now have insufficient evidence, and what that means is there's some studies that show that client incentives work to increase breast cancer screening, and some studies that show that it hasn't been shown to be effective. And I think if you ask around people that do programs, that's what you'll hear. That, you know, sometimes you give them gas cards and it gets them there, and sometimes there's other barriers that maybe we're not able to overcome with those incentives. So what we say is, if that's something you want to do, you want to make sure that you have a strong evaluation around it, so you can show your funder or show your program manager that this is a worthwhile thing to do. None of them are not recommended, so that's good. I think sometimes we don't publish the negative data, but we do have some good data on the others. So when it says recommended, that means that they've been shown to increase breast cancer screening. So when you click on client reminders to get more information, they have a lot of good information. So it tells you what we mean by client reminders, follow-up, or printed or telephone reminders, and then additional text or discussion about benefits, indications for, and ways to overcome barriers. So maybe people have a script that they follow when they do these client reminders. They also assist with scheduling appointments. These interventions can be untailored or tailored to address, who you're trying to get screened. And what we mean by tailored is you might say their name, you might, we see that you're over 50 and you should be getting a mammogram. That's tailored instead of, time for your mammogram, please call us back. So I think it has a lot of good information for when you're thinking about adding a strategy to your program, what else you want to be looking at. And so further down, you can see more information what they found with the reviews for breast cancer. So with the systematic review, they looked at 22 studies, and they looked at kind of different, it's all about mammography, but mammography screening, and then recent mammography screening, and then repeat mammography screening. So you can see they're getting more specific about what the studies are showing. So you can see a 14% percentage increase. And then we have more information about enhanced and telephone reminders show a greater increase, almost 16% increased percentage. And then when you add other types of intervention, the median incremental effect for client reminders was an increase of 5%. So you get a lot more information than I think we've had in the past, and I think this helps you know if you see a problem in your program and people aren't showing up for their screening, how this can help you increase your numbers and also help you plan with how many people you're going to be seeing. And I think when Lynn's program did an intervention, they've gotten even higher percentages than this. Is that correct, Lynn? Do y'all have any questions about what I'm talking about? So on the left-hand side, you can see that there's more information you can get. So there's a link to supporting materials, and there's a link to our tips, and so I'm going to show you what is there. So supporting materials has information about evidence gaps. It also has the task force findings kind of in a table. So some more information. There's also citations on the website. If you scroll down to that area, you can see what you need to cite if you want to talk about using one of these interventions and how it's improved breast cancer screening. So they also talk about evidence gaps, which I just was explaining. So you can see what they identified as evidence gaps, and I think these are good for us to keep in mind when you are looking at, trying to change a behavior, because some things, sometimes we're working in a broken healthcare system and we're trying to make this one change, but we have to keep in mind that there's, we need to look at policies and direct resources to increase the cost relief of cancer services. And another thing that I think you do here is the shortage of radiologists who read mammograms is going to maybe be more of a factor in the future. And this was talking about the closing of breast cancer facilities. So again, those things are going to impact your program and how well it's going to work if there's a backup to getting women screened. So I think these are good things to keep in mind, and also moving forward if it's anything you want to do research on or try to improve. So that's where you would see the supporting materials right there. And then I'm going to go show you what is under our tips. So that's not a link to our tips, but it tells you more about what is our tips and what criteria they used. I used to get questions about why isn't this program on our tips, or this program used to be on our tips and why is it not there anymore. So this gives us more information about the programs on our tips. That they've been implemented in a community or a clinical setting. They were tested by researchers, so they had a strong, rigorous study around it. And then you can get the materials for free, so we didn't want there to be a cost with them, or they can be downloaded or ordered on a CD-ROM. And then if you do want to order directly from the materials, there may be a cost with that, but we didn't want to put things up there that were really hard to get information from. We didn't want to do that as a disservice. Well, not we, but the government did. And then the criteria was that the research findings were published in a peer-reviewed journal. They had a positive outcome, positive behavior change, and the positive behavior change was demonstrated at least in one study using experimental design. The messages and materials can be used at a clinical or a community setting, and they must have been conducted in the last 10 years. So I think that helps us address this. And I think the researchers have to be interested in wanting to put their study up, because I think it does add another few steps to make sure that their information is out there and able to be used. So that's kind of what is on our tips right now and the criteria they have around that. So again, you can go back to Cancer Control Planet and go to our tips, or you can go to that direct link which we gave you before. When you pull up our tips, it allows you to search for programs, and so this is the screenshot of the breast cancer screening programs that are there, and so you can see there's 21 programs, and then they're alphabetically listed, and you can see the program focus and the population focus. Sometimes you really have to go to each one to better understand what they're really trying to do. So it does take some time. I think they used to be kind of categorized differently, and it was easier to understand. So this is the first one. So you'll see it's called Breast Health Education Among Hispanic Elderly Women, and you can see how it's laid out. They talk about the need, the program. There's an implementation guide, which is always key, and then the community preventive task force findings, time required, the intended audience, suitable settings, resources about the study, and key findings. And then there's a re-aim score, which helps you better understand how easy it is to implement it at a community level. and then it shows you where you can download the products or preview the materials. So a lot of great information for each one of these programs. And I've even gone to our tips and looked at the evaluation for the Witness Project. They had a good pre and post test evaluation, and so that helps some of the grantees have a start on a pre and post test. So you can even use those materials for that type of thing. So oftentimes we hear, well, that this isn't my exact audience, or you know, I'm looking at this type of problem. So what happens when there's little evidence? As I talked about, there is the Cochrane Collaboration, which you can go from Planet and get the passwords that you need to get on it, and then you can do keyword searches, and they do systematic reviews. So that does give you something similar to what you find kind of in the community guide. Not laid out as nice, but it still is a great resource if it's something that you don't see on the community guide. You can also do lit reviews and find individual studies, and so hopefully somebody has studied the population you're looking at and the behavior you're trying to change. So do y'all have any questions about when there's little evidence? Okay. Kind of in summary, you know, this is, as Linda mentioned, kind of two sections of a longer training, and if it's if you're interested in hearing more about the next steps, Linda and I can offer that to you, whether it's through a webinar or, you know, maybe there's something we could do in person. But just to wrap up, evidence-based approaches include programs, policies, and strategies. They save time. Nobody ever wants to reinvent the wheel if you don't have to, and it's really expensive to reinvent the wheel. So they can be adapted. You know, Lynn could talk to you about the Avon Project that they did with St. Luke's Episcopal Health Charities, how they adapted that program and have made it a really successful program and have the numbers to show that it's getting more women screened. It's a benefit to the community. They're saving lives by that program, and it's available for different health promotion areas. So not just breast cancer screening, you do the same steps for other kinds of screening. Okay, the password, that's through Planet, Cancer Control Planet, and that is under, it's kind of under research synthesis, and then once you're under research synthesis, it'd be for additional reviews, and that's where you can find information about survivorship. They actually have some reviews right there in Planet, and then at the bottom it talks to you about how you get the password for the Cochrane Collaboration. It's through Wiley Scientific, so. Okay, thanks, Leah. And as Linda mentioned, we want to acknowledge the Cancer Prevention and Control Research Network, the capacity building work group. They created these slides and they have some great notes, and so it's been easy to follow. So we appreciate their work on this, and Dr. Maria Fernandez's group at UT School of Public Health, Latinos in a Network for Cancer Control. If you want more information, please let us know. It's a great group to be part of because you hear about what other people are doing and learn from others. The Community Networks program, that is at
MD Anderson
and School of Public Health, yeah. And the Center for Community Engaged Translational Research is at MD Anderson, and then I'm with Komen Houston, and we, gave out $2.9 million this year, and that is one thing we look at is evidence-based resources because we don't have the money to kind of reinvent the wheel. So we do look for evidence-based programs to fund. Yes.
Okay, so I'm gonna,
All callers are muted. All callers are unmuted.
so the phone's unmuted and we will accept questions by phone as well as by chat. Does anyone have any questions?
Now, all common affiliates want evidence-based also, correct? Because I know we've got like Gina Lawson from Austin too, and they were part of that also.
Could everyone hear that?
As Lynn mentioned, all common affiliates are looking for evidence-based programs to fund as well, and we have 13 affiliates in the state. So if you are applying for funding through other affiliates, you know, you can call them and talk to them about their process.
The slideshow will be available, it'll be on our website.
We forgot to tell you how to get a hold of us. I will write that right here.
And we can add it to the slide set before it's sent out. So just talking about grants that require using evidence-based programs, the Latinos in a Network for Cancer Control has mini grants that it's for across the state, and they also require using evidence-based programs or strategies. Those are under Dr. Maria Fernandez at the School of Public Health and Belinda Reininger, who's in Brownsville School of Public Health. And they have released 2 mini grant cycles, and they're about to release a 3rd. And we'd be happy to send that through the Breast Health Collaborative.
Any more questions?
I don't know if we've sufficiently covered the out of the box and what happens when there is no evidence. I tried to briefly cover it in your program you may have a strategy that you can find that has been tested and there's evidence that shows it works. So you can talk more specifically about that specific strategy in your program or your idea. And the other, Jenny mentioned that there are other resources to look for besides the community guide. And then the third component that we didn't talk about is a rigorous evaluation of your program or strategy. So if you don't know that this certain thing that you want to do might work, then you have to have a very strong evaluation about the strategy or the program that you're testing. And sometimes we don't have that expertise, so it's good to partner with someone who may be an evaluation expert. Through the School of Public Health is usually a good idea, or there are some independent evaluators. Even the University of Houston, some of the faculty could be helpful, or any of the university public health schools. I'm thinking Houston, but throughout the state, any university public health program, health education program would be a great collaborator to help you evaluate your program. Tech, yes, A&M.
Any other questions? Yeah, so thank you very much, Linda and Jenny. That was a really great, informative presentation. We do have, I'm gonna send an email. So the presentation, I'm gonna send an email with a link of where you all can find it on our website, so you will have it. What I was also saying was we'd like to thank our program committee for organizing our webinars, and that committee is chaired by Laura Pena of Harris Health Systems, and the committee members include Lizette Martinez and Yesenia Mora of Harris Health Systems as well as Gina Lawson with BCCS. And our next webinar will be July 25th at 12. And stay tuned. We're going to be announcing our speaker and topic through email, so we will let you all know very soon. We do have one more question, it looks like. Oh, maybe that's for us. Also, can agency schedule a presentation from Kelly? Oh, yes, in the file in the corner. You can also save it that way. But a full recording of the webinar will be online.
And on YouTube.
Yeah, and on YouTube.
And you can contact Linda and me about scheduling a presentation,
Oh, great.
and or how we can help.
And I'll include their information in the email that I send out as well.
Okay.
So if there are no further questions, thank you everyone for calling in and for participating. We really appreciate it. And until next time, thank you again.